May I just move on to, we're going to have to wrap up soon, so may I just ask my cardiology colleagues something here, and let's ask the whole audience, in fact. I'd be interested to see this by a show of hands. We saw this morning, Sanjay showed one example of a patient, young diabetic patient with type proximal LAD disease, and both the cardiologists said, we'll stick a stent in it. In fact, the best treatment over the long term for proximal LAD disease in a diabetic patient is a single IMA graft. Now, I'd be the first to accept the patient may not want an IMA graft, but I certainly believe they should be offered the option of it. So I thought this was a great example of the lack of informed consent. Both said stick a stent. So let me ask my cardiology colleagues just now, do they agree with the principle that all interventions in the elective setting should be discussed as a part of a multidisciplinary team?
Absolutely not. I went through this. We do a lot. We have a very close group at Scripps Clinic. We have surgeons. We used to have a PCI committee that would meet for every single patient.
Raj, what do you think?
I think it is not. It would be ideal, but it is not practical. I think patients. It's an emotional thing for a patient to have multiple procedures.
Okay. Ted, what do you think? We're running out of time.
As you have stated almost every position you have, you stated in the extreme that every patient should have a multidisciplinary discussion. In our practice, every patient in whom, in our usual practice, the decision isn't obvious, and I think that's what Paul is talking about, we have a very multidisciplinary discussion. And in every patient, we have a discussion with the referring physician from the cath lab before the patient is subjected to a staged repeat outing, to make sure that if there's a consensus with the referring internist or general cardiologist that PCI is appropriate, that we can take care of it at one setting. But that, yeah, that's a different thing than every patient.
One final comment by Dr. Mack.
So David, I did live with that for a couple years, and I think we enrolled 48 patients in Syntax altogether, and we did do this multidisciplinary team, and it is a major hassle for everybody involved, from the cardiologist taking a patient off of the table to a surgeon leaving the operating room. And what we found is that about 80% of the time we totally agreed, and 20% of the time we had a disagreement, and that was worthy of discussion. And what we came out of that is, for the majority of the patients, we do agree, and in those 20%, and I think we have a good read from each other in who those patients are, then it is worthwhile, the discussion.
I want to thank our esteemed panel for a